and it could be that folks join us. Welcome to this afternoon session. It takes, I'm going to say, when we did it earlier today, it took about 20 minutes, 20 to 30 minutes, and then we had time for questions. So feel free to ask anything. My name is Melissa Leipold, and I'm the program director for the Women's and Men's Health Programs. It looks like we have Lynn Jones on. She's one of our nurse case managers and navigators. And then Raji is our administrative assistant. So that's who is on the call.
And Choice is my clinic.
Oh, there you go. Okay. So I'm going to go ahead and share my screen. Are you guys seeing the slide presentation? Raji? Yes?
Yes.
Okay.
Yep, we got it here.
Okay, perfect. Perfect. So this is what you're seeing up on the screen is our new logo, Women's and Men's Health Programs. All of these programs are within our office. So you'll see the breast, cervical, colon, and heart. We have programs that address each of those screenings and topics in our office. So we have the Every Woman Matters program, which you may be, I'm sure you're familiar with, and then the Nebraska Colon Cancer Screening Program are our biggest programs. Oh, let's see if there we go. This is our team. So we have about 13 on the team. Most of all of our stuff is done within our office. So all of our billing, clinic, data entry, navigation, professional education, public education, evaluation, quality assurance. All of our team work on that, and we work generally across teams. So there isn't anyone that just does breast cancer or just does cervical. So we are a fully integrated team. We do have a new mission statement. So our mission statement is to ensure Nebraska women and men have access to cancer screening and preventive resources. And then our vision is that Nebraska women and men live healthy and cancer-free lives. The program is 33 years old this month. The program that has been here the longest is the Every Woman Matters program, which is our breast and cervical cancer early detection program. We have Wise Woman services as well, but those two programs together fall under the Every Woman Matters program. So a lot of our providers and even clients really don't know the Wise Woman name because it's all integrated within the breast and cervical cancer program. We've had that program since about 2000. We also have the Nebraska Colon Cancer Program, which we distribute fit kits within our office, but we also have community distribution across the state, especially during the month of March. The program has over 435 provider sites. Any provider that serves women that accepts our reimbursement rate, completes the appropriate clinical documentation, and signs a provider participant agreement is eligible to provide services for the program. It is expected that women will receive all services for which she's eligible for across all of our programs. And we have a regular enrollment form, which women can enroll online. They can mail a copy. They can send an email. So there's a lot of different ways that women enroll or get a hold of an enrollment form and send it in. When they do that, we're determining eligibility, and then she's showing up at your office with a screening card in hand. This new option gives clinics the ability to do presumptive eligibility on site. And the benefit of that is if you see a client in your office today and you also want to screen her, you could enroll her and complete a determine eligibility and then screen her that same day. And so it really decreases structural barriers for that individual. This is the front of our presumptive eligibility questionnaire. And we do have on all of the enrollment forms, we do have the eligibility criteria on the front to determine whether or not they're program eligible. So staff can quickly look at the front if they forget who might be eligible, just to double check. I think for some of our clients, it is kind of a lengthy enrollment form, especially if she's eligible for all services. And so it's disappointing for someone to fill out the whole thing and come to find out she's over income. And this way you could quickly look and determine that before she starts completing it. Let's see if I make sure. Before you deliver the services, you do need to complete the healthy questionnaire, and primarily because there's information that she's going to put on there that determines whether or not she is service eligible. So the completed form then gets returned along with the office visit or the screening card, which is actually attached to this form. So it all comes in kind of like one package deal. One of the quickest ways to make sure that staff is familiar with the program and identifies clients as they come in is to know what services are covered by the program. You are welcome to download and keep some of the enrollment forms on hand if you want to do them in a hard copy form. You can also assist them, individuals, in completing the forms. They can also go online and complete them as well. So you could help her do one and then do it online. If you're doing it online, you will have to upload the permanent resident card if client is not a citizen, but she is meeting those residency and eligibility requirements. If a client already that you're seeing that day is already experiencing symptoms or has a breast lump, then this form is not really the one to start with. You're really wanting to start with the diagnostic enrollment form, and that information is out on the website as well, but you can always call to get assistance in knowing exactly what to do or what form to fill out. Like I said, the online ones are available, but there is also a click button to help her do it online as well. The HLQs you see here, and this is what the website looks like, this little box that's got the blue on it. So when you go to the website, you'll be able to go down to the heading Presumptive Enrollment tab. And when you click on that, you'll see that the enrollment form is both in English and in Spanish. And you can also listen to this presentation again. So there is the slide deck is out there already. So if you've got staff that wasn't able to come today and you'd like them to listen to it, you could go there. We also will be putting a recording out there of one of these sessions. I think we'll wait till we're all done and then try to pick the best one to set out there in case someone wants to listen to it and actually go through the whole thing. There's two types of eligibility determination, and one of them is to find out whether or not she is program eligible. So this is the enrollment form. You will see this front page is actually in the middle, and that absolutely has to, everything on there has to be completed. This one that's on the far left is the informed consent and release of information. So she is not enrolled until she has signed that information first. And I'm going to see if I can blow it up a little. It's kind of tiny, but maybe I can't do that here. Oh, maybe not. I'll look for that for the next one. But you will see there is here, she can check and attest to citizenship. If she is not a citizen, she can attest to being a permanent resident. And this is a state law. So it's not our requirement, but it is a state law. And if she is not a citizen and has a permanent resident card, we do have to check to see if she is in the SAVE system. So that's a federal system that we have to check by law. What else? On here, if I were to blow this up, like I said, I don't know where get bigger button is. Maybe here. Oh, a little. You'll see you kind of have a little bit of a cheat sheets for your staff to go through here a little bit quicker. So on the top of each one, it tells you who should complete this by age. So this one here is the personal history for breast and cervical. And so all women need to complete that regardless of age. But when you get down to the section on colon cancer, only men and women 45 to 74 would complete this to determine whether or not they're eligible for colon cancer screening. So each section is kind of in the yellow tells you what age should be completing. So if you've got someone who is 21, they may not need to complete the whole thing. And it'll tell you where to stop for that particular age. For our program to determine who is program eligible. So program eligible means that she can actually enroll in the program. They have to be uninsured clients 21 to 64. At the age of 64, we would expect that most of these clients are eligible for Medicare. Occasionally, we may have someone who is older than 64 who, for whatever reason, is not eligible for Medicare, and that will be on a case-by-case basis. You'd have to call and talk with us. They have to be United States residents or here legally with a permanent resident card. They also have to be income. So two things have changed in the program. We've lowered the age for women to enroll, which is down to 21, and we've increased the income. So individuals can be up to 250% of the federal poverty guidelines and still qualify. That would be like a family of 4 making approximately $78,000. So it's pretty generous. This is just a reminder for uninsured clients. Clients with private insurance, Medicare Part B, Medicaid are not eligible for screening services, and they should be encouraged to understand their benefits and use them. All of those coverages pay for preventive screening without copays and or deductibles. If for some reason they have a health plan that looks a little bit different, sometimes we have folks that come in with a cancer insurance and no other insurance, and that's really not a credible insurance. So if you think someone has an insurance plan that does not cover preventive services, but you're not sure, you could give us a call and we'll have a navigator actually look all the way through. And sometimes we know if we've seen that insurance company before. Any client that is coming in for diagnostics, so not screening, but diagnostics, it could be that they have a private insurance, and it could be that they still qualify for the program. So if you have a client, as long as they're meeting age and income, we will help some women that are under that 250% pay for diagnostic exams after insurance has paid. So we are the payer of last resort, but that does mean that we could help with copays and or deductibles for the client. The residency one. So clients have to qualify, be a qualified alien, which means they have to have a permanent resident card with their application. So two things about that. You can, from talking with our Joey is one of our navigators, and she does a lot of the save checks for us. She said it is extremely rare that you have someone that has a permanent resident card and they are not in the save system. So clients that are not in the save system that we sometimes see and have to turn away are those that are presenting with a passport, an employment authorization card, or something like that. Maybe just a visitor's visa card. Those are not sufficient, and a lot of times they are not in the save system. If you want to make sure that she is before you serve her, you could call and send a copy of the permanent resident card. If we have staff available, they could check online to see if she's in the save system. We won't always have somebody available, or they could be tied up with other activities. So you have a couple of choices. You could go ahead and serve them if you know you have the permanent resident card, and then when you send in everything, you'll send us the permanent resident card. Or you could not see them, but send everything into us and have us do the eligibility check. If we do that, what will happen is that we'll be sending her a screening card, and then she would show up in your clinic just like anyone else. Income guidelines, we just talked about that. So anyone up to 250% of the federal poverty guidelines is eligible. We do have a list again on the site, but on the front of their enrollment form, again, we have the income guidelines up to so many household members. So you can look there to determine eligibility for income. Income is self-reported. So we don't do any other verification other than what the client says on the screening card. For those who have farm incomes or non-farm self-employment, they record the amount of net income after business deductions. If the client has no income, you need to put 0 on there. If you leave it blank, we won't know and we won't process it. So we'd be sending it back to you for an income. Other factors that determine eligibility, and this isn't really eligibility for the program, this is really service eligibility. So once you've done that first set, the insurance, the income, insurance, income, and age, she is program eligible if she meets all those requirements, but she might not be due for services. So things that we look at, we are held to following the U.S. Preventive Service Task Force guidelines, has to be an A or B rating. We look at her screening history and we look at her personal history to determine whether or not she is due for services. Here are the guidelines. We've got them there. You can go and look at them. We have a link as well. So you've got cervical cancer screening is different by age. So 21 to 29, you're looking at cytology or pap smears every 3 years. Women 35 to 65 are looking at either pap smears every 3 years, co-testing with pap smear and or high-risk HPV every 5. And new guidelines are now coming out that I think are going to be in line with every 5 years testing for high-risk HPV alone. For breast cancer, they have to be at least 40 years of age to receive biennial screening, so screening every other year. Of course, if you've got someone who is at high risk or has a personal history, that may change the frequency for which she's allowed to come in. Men and women 45 to 74 can come in and get a FIT test annually from us if they're at average risk. We have some individuals that enroll that may be at a higher risk for colon cancer, and we would order colonoscopy as their first screening test as opposed to a FIT. But the majority of our clients are at average risk and just get a FIT kit annually. Screening history, again, when you mark on the HLQ, there'll be those questions about when was her last pap smear, when was her last mammogram. And again, we follow the guidelines. So if she puts on there that it has been more than 5 years since her last pap smear, depending on how old she is, she would be due for cervical cancer. If she's under the age of 30 and it's been greater than 3 years since her last pap smear, again, she would be program service eligible for screening. For breast cancer, if she's 40 to 64 and it's been over 2 years, she would be eligible. Again, if she is high risk or has a mother, parent, sibling, or sister, well, that would be well, men can have breast cancer too, I guess. So, but that may increase the frequency for which your providers want to order services. If a client, once a client is enrolled, we've got this little bit at the bottom. if your client, you've done presumptive eligibility, a year from now, or when she is due for her next screening exam, she'll show up on our list as needing to be rescreened. And at that time, we would send her a rescreening enrollment form. She'd complete that, and we would be sending her a rescreening card, which means she'd show up at your office with a screening card at that time. Personal history. This is specifically related. We'll have some women that you may have that are eligible for MRI breast screening. And so we're looking at BRCA1, BRCA2 gene mutations if they've got them. But women aged 25 to 39 with that risk would be eligible for annual MRI screening of the breast. And then clients 40 to 64 would be eligible for annual screening, and then alternating every 6 months with MRI screening. When you order MRIs, we do have a form on the page 4 on the diagnostic form, which allows you to say that client is at risk and you're wanting to order MRI. So those are the only thing that we have that's diagnostic, that's pre-approved before you do them. And it's really just because of the amount of expense of the MRI. Once you're done with the HLQ, what is on the back of the presumptive eligibility ones will be the screening card. So page 9 is the screening card. You'll mark services provided on there. The HLQ also allows you to read through some of the behavior questions. We've got smoking questions, health history, that is an opportunity to discuss with the client about preventive services needed. In order to be reimbursed for the presumptive eligibility, you do have to complete the card. So this is an all services card, which is what's on the back of our HLQ. And let's see if I can make this a little bigger. Oh, there we go. So the first column is the general services. So we do expect height and weight on all clients. If they are over the age of 35 and you are wanting the risk reduction counseling reimbursement rate, we would expect 2 blood pressures. That is the standard, 2 blood pressures at least 5 minutes apart. You would assess clients' need for risk reduction counseling, whether or not they're taking medication. I'm talking to them about medication adherence. So that is all in this green box. Everything in here needs to be completed if your client is over the 35 and you're wanting reimbursement for risk reduction counseling. The new thing that we have on this card is this new green box. This is a requirement for our Wise Woman program. And so inadvertently, since Wise Woman clients are breast and cervical, we'll see that on a lot more of our clients. This is the SDOH, Social Determinants of Health Assessment. These questions are already embedded in the presumptive eligibility form. So once you've completed that in full, you'll be able just to mark that you've done the SDOH assessment. The program will begin working with Unitas. I'm not sure if you're familiar with that, but it's a portal to make referrals for individuals that have items that show up on the SDOH assessment that would imply that the client has specific essential needs that need to be addressed before she can make her health a priority. So we are working on that. You'll see more come out from us. But if you've made the referral, we do have clinics that are already using that platform and you've checked those boxes. We would reimburse the global rate that Medicare gets on that rate, which is about an additional $10. I will say that for our clients that we have been screening since about February, about 24% have and mark that they have food insecurity. About 14% say that they have housing insecurity. And then we have, I'll have to double check, but I think it's about 20% that have trouble obtaining medication or taking their medication as scheduled due to cost. The CVD and diabetes screening is the next card here. And so on our program, if your clients are 35 to 64, we would expect that they get blood work ordered or done, which is total cholesterol, HDL, LDL, triglycerides, and an A1C or blood glucose. The colon cancer is down here. Since you're doing presumptive eligibility, unless you have kits at your office that you distribute on a regular basis, you could mark that you would like us to distribute a kit. And then once we get the information in, we'll mail her a fit kit. Mammography is on here again. If you're ordering a mammogram, you need to make sure that you give her the mammography reporting form, just like you do for all of your other clients that are enrolled with us. Screening pap test, you can let us know what services were done, whether it was a pap test, HPV, high risk, or if something was not performed. So anything that you do in the office, you are marking on the card. And again, you need to date it. The office visit needs to be the date of services. And then the clinician needs to sign it with the clinic name and city. Frequently asked questions that we're getting. What if the client screening has an abnormal result? We do follow the ASCCP consensus guidelines and the NCCN clinical guidelines for breast abnormalities. Once the client's enrolled, she can get any diagnostics that are appropriate, and you can go ahead and order those without checking with us. The only difference would be the MRI. So if the client's needing a screening MRI, then they must submit a request for like a pre-authorization kind of, and your justification as to why they might need that. What if the client is screened and eligibility was done incorrectly by the client? So what we're talking about here is really program eligibility. So the client is over income, she's not appropriate age, or she is not a citizen. Those clients, if we would get that in and we would do the double check and they are not eligible, we would not be able to pay for services. If you ordered something that was outside of guidelines, let's say a mammogram too soon, or a pap smear that was not quite due, those types of things generally we're just going to monitor, but she is program eligible and we would pay for those. So it would just be those that are not program eligible that there would be a problem. What if a client has a permanent resident card but is not in the SAFE system? And I talked about that a little bit earlier. If it truly is a permanent resident card, it is seldom that client is not in the SAFE system. But you could, if you're concerned about that or your staff is concerned about that, they can call ahead of time. Or those clients that have a permanent resident card, you could just not do presumptive eligibility, but mail or send it to us online, and we would determine eligibility and then in turn give you the client a screening card to make an appointment. And that was a lot of information. Ryan, do you have any questions?
No, this was helpful. It was good to go through it all. I was just kind of curious about some of the changes, so this is good.
Excellent. Okay. We have other sessions, and you must have gotten an email.
Our provider did, and I told
Okay.
her, hey, I just want to sit in on this, so I think
Oh,
she's going to
absolutely.
sit in. Yep.
Okay. Anytime you have questions, they're welcome to sit. I think we're done with 3 out of the 12, so we have quite a few yet to go. But if anyone has questions in between or as you get started, feel free just to call. call
Okay.
or email, and we're pretty quick about answering.
Okay.
And
that
Lynn's
sounds good.
fantastic, so.
And Melissa, just to let you know, Jessica Lothrop, their provider, and I have been in touch with each other and are planning a training for the clinic. So,
Oh, excellent.
Good deal. Yeah, thanks for doing that.
Yeah, thanks for
Thanks
your
for-
time.
yeah, thanks for being on there, Ryan.
Good deal. All right. Well, you guys have a good night.
Yep, you too.
Okay, bye.
Bye-bye.